Hi, it's Dr. Van Dusen at New Hope Chiropractic. All doctors know the importance of getting a good and accurate diagnosis of a patient's problem when they come through the door, but why is this actually so important? It's important because it's difficult to achieve a positive treatment outcome, really getting the patient well, without knowing more about what disease or injury is present and what we're dealing with. Unfortunately, when it comes to headaches, many patients don't receive an accurate diagnosis. If a patient were to see a doctor with a pain in the head, and the doctor were to conclude that the patient has a headache, this tells little about the actual problem. In headache patients, we've become very good at labeling problems and giving them a name. And if the headache comes and goes, we call it episodic, for example. If it occurs suddenly, we call it acute. And if it occurs over many years, we say it's a chronic headache. But are these labels really of that much help? Well, the reality is that everyday people show up in doctor's offices and they get a cursory exam and they walk out with a prescription for their head pain. And not all doctors do this, of course, but with the time constraints of managed care, HMOs, and the insurance company oversight, a doctor's visit is just not what it used to be. And the family doctor making house calls, forget about it. Of course, the worst case is when a patient acts as their own doctor, sees an ad on TV or in a magazine or on the internet and does the diagnosing himself or herself. That's the worst. Warning, don't try this at home, right? In chiropractic, we may also label your headache as a tension type headache, migraine, or chronic, but a good chiropractor will not stop there. The label does not give much of an indication of what needs to be done, and more importantly, we still don't know the cause of the pain. Clinical experience and research over many decades has shown that many headaches are actually caused by injuries to the neck and spine. But if a doctor does not examine the neck, they may not discover these hidden injuries. Sometimes an astute doctor will take a history and may discover you had a whiplash or other neck trauma months or even years ago. But this is important information to get at the cause. So a good consultation is important too. Your doctor of chiropractic will likely take a detailed history about the location, duration, and also the quality of the pain, followed by a thorough physical exam, especially of your spinal column. We may also order imaging tests, x-rays, or even an MRI, see positions of the individual vertebrae in the neck and the condition of the soft tissue if indicated, if it's necessary. The normal neck has a forward curve or arch which keeps your head upright and directly above your shoulders. It also acts as a shock absorber. When this curve is lost, the patient's head is thrust forward in a classic bad posture stance of head forward. So making sure your neck is both flexible and also in good postural alignment is really critical in maintaining good health and reducing the impact of headaches in your daily life. And we here at New Hope Chiropractic, with a thorough consultation and exam, and then the appropriate adjustments in the right places of your neck, can help do that. By doing this, we may be able to help not only the alignment of your neck, but also the movement of the individual vertebrae in the neck as a whole, and also, most importantly, remove the pressure and interference of the nerves coming off your neck. So please check us out at newhopechiropractic.com. You can also make an appointment through our website, and we look forward to answering your questions about your health and helping you. Have a healthy day.